We were treating acute myeloid leukemia with 7 and 3 in 1977. Today in 2019 we are still doing the same. What is the best way forward to change this by 2029?
Okay, it's a disaster, you know. We really we did nothing about the era in acute myeloid leukemia. So unquestionably, we really needed a new model in the therapy of acute myeloid leukemia, and we need to find a new target to cure the leukemia patient, not only the leukemia patient, but maybe near all cancer patients, you know. And we need to use targeted therapies instead of the conventional cytotoxic therapies. We really need to focus on the pathophysiology of the malignant cells, and more deeply, as we know that FDA, for example, approved a new drugs for AML, venetoclax, last year, and we need to focus on the surface proteins, focus on the defective molecular pathways. We need to focus on the genetical mutations. We really should be change our way, and we really need to stop giving 7+3 for acute myeloid leukemia patient. I hope that in next 10 years we used a very focused on understanding the pathophysiology of the cancer and focus on the most modern therapies other than cytotoxic therapy.
Thank you. Second question. There are 3.5 million papers published in cancer. 135,000 just in 2017 alone. There is a staggering disconnect between great scientific insights and translation into improved therapies. What are we doing wrong?
Yeah, you're totally right. There is a huge discrepancy between the research lab and the clinics, you know. Unfortunately, we are unable to transfer the knowledge to the clinical setup, you know. It is a huge problem, and we need to transfer the knowledge to bedside. And I think that maybe the problem, the basic research and the researchers isolated themselves, you know. There are not a big contact between the clinical physicians and the research guys, you know. It is a kind of it is a big problem, and we need patient-oriented research. We really need to do that, and physicians who observe every stage of disease and directly deal with patient should be integrated to medical research more, and this is very important. You know that the animal studies, for example, is that really logical? I don't know. We have a lot of problems regarding the animal studies. You know, it is not representative for humans. So we really need to do more research by using the cancer tissues, maybe the human cancer tissues, and we focused on to find some other ways other than animal studies, and we really need to collaborate with the basic researchers. Otherwise, most of the studies is a kind of waste of time, you know. We spend a lot of money, we lose money, and from the clinical point of view, this means nothing.
Very true. The third question is that the fact that children respond to the same treatment better than adults, seems to suggest that the cancer biology is different.
Yeah,
But it can also suggest that the host is different.
yeah,
Since most cancers increase with age and older people get more cancers, that means even good therapy may not work in older people because of their status. So, what is your solution for this?
oh, I don't have an exact solution, of course, but I know the problem. The childhood cancers treated more easily because they had a specific mutations. They had acquired mutations in tumor suppressor or oncogenic genes, but in adults, it's totally different. We accumulate new and more mutations, which is very critical. For example, nowadays we really define the role of chip in cardiovascular diseases, for example. It is very critical. We accumulate a lot of mutations. We really do not know the exact drivers of the cancers in adult population. So we really need to find some other ways. It is not a good idea to follow the way of the childhood cancer treatment. We really need to find some other ways. And microenvironment is also critical. According to the seed and soil hypothesis, we know microenvironment in adult tissues are more favorable for cancer growth. So we try to control. I really don't have an idea what should we do, but we really need to focus the meaning of the somatic mutations, for example, in adults population. It's very critical, and really we need to more human tissue studies in adult populations, and we really need to focus on the role of the microenvironmental defects in cancer in older and adult population. It's totally different than the childhood cancer.
Okay. Mustafa, you have great knowledge and experience in the field. If I was going to give you limitless resources and all the money you want, what will be your solution to find a cure for cancer?
My solution is, if I have a huge amount of money, I spend my money to prevent the cancer, not the cure of the cancer. Prevention is the very critical point in the area of cancer. We have a lot of, we use a lot of, for example, smoking, for example, is very critical. We have a lot of cancerogenic effect in our life. We need to eliminate it, and we really need to focus the prevention. We do nothing about prevention, we wait for the patients to be cancer and start to cure them. It's not a good idea. I remember a Chinese story, that in China, many years old, during the ancient time, doctors take their salary depends on the number of the healthy people in their era, If someone become ill, then the salary was reduced. It is very critical. The prevention is the magic words that we need to do for cancer.
Very good answer. And the last question is a philosophical one. Offering patients with advanced stage non-curable cancer palliative but toxic treatments is a service or a disservice in the current therapeutic landscape?
Yes. Personally, I really, in my clinical practice, I usually avoid giving cytotoxic therapy. Just for a few months, the overall survival differences is so limited, The most critical one is the quality of life. So we need to admire the supportive care, you know. The good life is the critical, not the long life. So I really don't want to use cytotoxic therapies, especially in older and fragile patients, you know. So we really need to find a way to solve the problem. For example, in elderly AML patients, we really do not have an option to cure them. Maybe it's more realistic to focus on the quality of life. This is very critical. Thank you so much.
Congratulations on being such a fine oncologist.
Thank you.
The answers you gave tells me that your heart goes out to the patient.
Thank you.
That is what makes a good doctor.
Thank you so much.
Thank you.
Okay.